Hi there. I just want to take a few minutes to go over this spreadsheet and hopefully answer any questions that you have or clear up any confusion that you may have with this. When you open this spreadsheet, you'll come to the inputs and summary sheet, and you'll see some purple cells. These purple cells are where you will make changes. The rest of the spreadsheet, this spreadsheet and these other ones throughout the entire workbook are formula based. I have formulas in here that you can look at, but please don't make changes because it'll mess up the calculations. When you go to the Blue Cross Blue Shield, you'll see I also have some purple cells here. These are where you enter the monthly premiums and the HSA contribution from the church into the employee's HSA, which currently the church, to my understanding, is putting $1,000 into each HSA account. These numbers here were gathered from Kim, and so I believe they're accurate based on this last year. We may have to update them with the new year, but that's easy to do. But at this point, we won't make changes there. And the rest of these tabs, again, you feel free to look at it, but please don't make any changes, and that you can see the breakdown of the costs. All of those costs, all of those data from these tabs are all represent, or the totals are presented here in this table. So really this sheet is the only one you need to focus on. So first thing you'll do is enter your family name. For example, if I enter Bullers, you will see that we have ones entered here and several zeros. Ones are shown if that individual is included in the plan, and I already have it pre-programmed to account for each one of your families. So Bullers, we have Pastor Dave, Emily, and their 4 children here. Child 5, 6, and 7 are zeroed out at this point in time. Pastor Ken, or the Edgars, we have 1 on Pastor Ken and Rachel, and Nears on the other extreme, we have 1s all the way down through child 7. And so if there are 1s entered on a row, or if a 1 is entered on a row, then these data here are all included in the calculations. And so everything in this entire table with the Nears will be used. If, for example, we go to Edgars, these are zeros, these data are not being used. And so I could enter whatever I wanted here. I could enter $1 million, and nothing's going to change because this is a 0. So that's already pre-programmed for you, so you don't need to mess with this. I just wanted to wanted to make you aware of that so that you know whether or not the data over here, those data are being used or not. So let me go through in a quick example here. I'm going to go ahead and select the Bullers, and I'll run through my own family. We've got 4 kids, and so it makes sense that I would choose the Bullers as a close representation. All right, so first I guess I should say, if it's kind of confusing having these already populated, I just kind of threw some numbers in there. If you want to start fresh, you can highlight all the cells and hit delete and start with a clean slate. If you look down here at the graph, I want to bring one thing to your attention. So what we have here are annual costs for the church. These are the premium amounts, and you might wonder why we have a negative $1,000 on Blue Cross Blue Shield. That's because the church contributes $1,000 into the employee's HSA, and so if you have 0 medical bills from this table up here, you will pocket in your HSA account $1,000, and that rolls over. And so it's not realistic, obviously, to have 0 medical costs, but that is why we have the negative 1,000 there. So let me go ahead and go through this example. And I guess I should say from the outset that it's obviously impossible to estimate how many doctor's visits you're going to have in the next year for you and your family, but I think we need to put an estimate in there. And so you can think back to what happened last year, previous years, or on average. So you may need to talk to your wife. I know I would if I wanted to have some somewhat accurate numbers based on past history. You could also do a worst case scenario, best case scenario, and average case. If you want to do multiple scenarios, you can do that as well and print each one out or save them as a separate file name and provide those to me. We can do that as well. All right, so I'm going to do an average case. So I've got myself, how many primary office care visits that I have last year. Last year, I actually don't even know who my primary care physician is, and so I put 0 there. Spouse, Carrie, she probably went once, and maybe each of the kids saw Dr. Buckles twice. Cost for those, maybe $150 a piece, and I can do that all the way down here, and that an average cost of $150. And you can see as I do that, these numbers change in the table based on the calculations that I have formulated, and the graph starts to change as well. Again, if I enter a 0 here, I have $150, but because I have 0, this doesn't come into play, but it's basically taking 0 times 150, which is 0. So again, I could enter $10,000 here and nothing changes. So just want to highlight that what you enter here has an impact in the calculations. Number of specialist office visits. Maybe I go see the foot doctor once. Carrie sees a specialist, and every other kid sees a specialist. And if they go see a specialist, we might walk out there with a $300 bill on average for each specialist care visit. Number of vision exams. We each go get our vision checked annually, and many plans cover this, but some plans do not. So I need to factor this in, and I just do something here. Okay, these plans, you'll notice the Guidestone plans, they have some sort of copay, and so that was factored in. If you saw the numbers change when I changed this to a 1, that's what's going on. Blue Cross Blue Shield's, to my understanding, that vision exam is not covered annually. You can go see the eye doctor, but you will pay for that, and it'll be applied to your deductible. Wellness visits. Every plan I looked at here includes one free wellness visit. And so what you enter here really doesn't change the results, but I think it's still necessary to put in here in case we look at some plans in the future that don't have wellness visits included, if there are some of those. So this should either be a 0 or a 1. If you have multiple wellness visits, then that would be 1 wellness visit and increase your primary office care visit by 1. So this has to be 0 or 1, this has to be 0 or 1. Okay, how many surgeries will we have? Well, maybe I'll have a surgery, Carrie won't, and every other kid will have ear tubes this year. And if we have surgery, it may be $1,500 on average, so I can bring that down. Again, you can see the numbers changing here. Number of emergency room visits. Well, based on previous years, I haven't had one for a while. Carrie hasn't had one for a while, but it seems like every year we have at least one kid having them, and I can mix these up. And if you want to think about individual kids, and Colt may be more prone to go in the emergency room, or actually Shaylin, maybe I want to give her 2 and the rest of them 0. If you want to think about that, you can. I might just do something like that. Stitches, I don't know, probably walk out a $750 bill. So we bring that in. Number of urgent care visits. Maybe we'll each go see urgent care once during the year, and that's $150 cost per visit. Number of outpatient services. Well, I'm going to just put 0 across the board. Think off the top of my head what these may be, or how these would be different than some of these others, but you may have some ideas that come to mind. So if I do have an outpatient service, I might put in $125, but I'm on the I could have entered that as 0, and again, it doesn't change calculations. Number of chiropractic services. Some of these health plans have like a copay if you go see a chiropractor. Your Blue Cross Blue Shield does not. If you go see a chiropractor, you can enter that in, or you can enter 0s across the board. Maybe it's $75 a visit. You can see how that affects things. Finally, we have number of generic prescriptions. And here, I guess I would challenge you to think about prescriptions in general. Don't just think generic and name brand. So maybe each of these everyone in our family will be on one prescription throughout the year and $50. You may be on some higher priced ones or foresee having higher priced ones. You can obviously do that as well. Okay, so I've got all these data entered for myself, my wife, and my 4 kids. It's just my best guess. All right, now I want to focus just for a minute on the results. And so here we've got cost for family. This is how much it costs you out of pocket for given this scenario up here, and given the health plan. This is how much money you'd have to pull out of your pocket to pay for the medical expenses. This would be the cost to the church. And finally, the total is the summation of these two. You can see this graphically right here. It breaks it down into annual cost for family, annual cost for church. So the top of the orange bar is the total cost. So you can see on the total, they're actually somewhat close. You can see that in these numbers right here. But there's quite a bit different, some fairly significant differences in the proportion of family versus cost to the church. Here's some summary statements. This includes coverage on you, 1 spouse, and 4 kids. If I entered Edgar's up here, which I can do, you can see everything changes, and this includes insurance coverage on you, 1 spouse, not multiple, and 0 kids. All right, let's go ahead and go back to Buller's. And the plan with the lowest annual family cost is Health Today, $2,830 right there. Somewhat significant change from what Blue Cross Blue Shield is. Plan with lowest annual cost to church is Blue Cross Blue Shield right there. And the lowest overall cost is the Health Choice 1000. So I could see a lot of different ways we can use these results to compare plans. And I want to show you, if I change this to Edgar's, we see drastic differences. And so I'm guessing, just off the top of my head, whatever plan is best for Buller's is probably also going to be best for the Nears, because we're talking husband, wife, and multiple kids. And it's probably going to be a different plan for Edgar's and Kim as well. So here you can see I've switched it to Edgar's, and right now, given our assumptions up there, the lowest annual family cost is Health Today, $720, versus Blue Cross Blue Shield, which is what we have currently at $1,975. And the lowest cost to church is Health Choice 5000. And that has the lowest overall cost as well. But you can see right here, everybody would be better off if we went Health Today. I guess everybody being the Edgar's and the church. We'd be paying less for the church, and Edgar's would be paying less. And so I guess that's one of the ways we can use this. And I still need to check with Guidestone and see if each employee or each covered individual or family can choose a different plan. So, for example, can Pastor Ken choose Health Today and Pastor Dave Health Choice 3000 and Nears Health Choice 5000 or whatever? I would assume we have that flexibility. I hope we have that flexibility, because then this tool becomes really useful. We can find the optimum plan for each employee. All right, so trying to think if there's anything else I want to show you. I guess if you have any questions, let me know. Shoot me an email, give me a call. But if you could start working on this table here and come up with your best guesses, again, save those, print them, do whatever, give them to me somehow. I think we'll be able to do some useful and neat things with this. I should also say that I'm probably going to be continually making changes to this spreadsheet, because I just found out the other day that the church covers 60% of the employee's deductible, and the employee covers 40%. I didn't know that previously, so that's not incorporated into here, so I still need to do that. So there's going to be additional iterations of this, but if we have this information in the purple sheet, your work as the employee will be done, because I'll be able to just plug those in to whatever iteration we end up with as far as spreadsheet. All right, that's all I've got. And we will hopefully see you soon. Pray about it. Need God's guidance throughout this whole process, and hopefully we'll make the right decision for all involved. See ya.